And Dr. Ackerman is back with us, and he's brought some important equipment to be used for people who have neuropathy, which is what we talk about. This, of course, is Whitney. You've seen her. Usually she's behind the camera, but she was on with Dr. Ackerman a few months ago when you were giving her an adjustment. So today I volunteered her for this experience. So what are we looking at, Dwayne?
So with peripheral neuropathy, a lot of patients have a lot of pain, and they want that controlled without drugs and medication.
Sure.
And we know that with peripheral neuropathy, the nerves aren't functioning properly. It's kind of like somebody turned the dimmer switch down on the nerves.
Good analogy, yes.
The impulses don't get back and forth. So the apparatus I brought with you today is something that we use that helps with pain and also helps to reactivate the nerves.
How does it feel, Whitney?
I don't feel anything yet.
Okay,
so we're going to do a quick little demo here.
Okay.
We're going to put a little bit of conductive media on here, and we're going to stimulate her ulnar nerve.
So is this kind of like the same gel they use for ultrasounds, et cetera?
Yes.
Yeah, okay. All right.
Yeah.
Took the thought right out of my head.
Yeah,
Okay.
so we're going to see how this works. See if I can do this
The other
so
hand.
you can see. So you feel it a little bit?
Oh, yeah, it tingles.
Okay.
Oh.
Now, I don't know if you can see that, but see her hand kind of twitching there?
Yes. So
So-
what's happening?
So we're stimulating the nerve to contract the muscles, which inhibits pain at the spinal level. And if you notice, we've got a electrode on the other side. We're actually sending an impulse all the way up the arm through the brachial plexus at the spinal level of C6, C7, coming down to the other side. And that's what gives us the analgesic effect. It activates the nerves, it turns the nerves back on. So it's like turning up the dimmer switch on your lights.
All right, so now Whitney's been going through this. Earlier she went through this with Dr. Ackerman. So when does a person feel the results of that testing?
So that's a great question.
30.
No, I'm trying to turn it off.
She was ready to go. Let's go.
So we use this more as a treatment than a diagnostic tool.
Okay.
So if we've got a neuropathy patient that has a lot of pain, we'll do this on them 2 to 3 times a week for 10 to 15 visits, and that kills a lot of their pain. So while our other treatment takes a little while to get results, we've talked about that in the past, it takes a few months. If we can get somebody out of pain quickly, they're typically a little happier.
And so you're gonna treat the same site, like wherever the need is, at that same site for repeated.
Yes. So we just did this on a nerve coming out of the neck, but we do it down the leg.
Okay.
So we hit there's a peroneal nerve that comes down. The sciatic nerve splits to the peroneal nerve, and we hit that nerve as it goes down the leg, because that's the nerve we need to activate and turn back on with peripheral neuropathy.
Whitney, so what was the experience like? I mean, it does kind of create a little anxiety to see it, right?
Yes, I was nervous at first, but I mean, after he did it, it was fine. It just tingles in the fingertips, and then once he like kind of turns up the gauge there, then you kind of feel it in your, I would say, your nerve a little bit.
Oh, yeah.
That's where I'm feeling it.
We're telling that nerve, we're turning that nerve on, and what that nerve does is it tells muscles to contract.
Yeah.
And I've used a lot of electrical currents in the past to treat pain, and if I got that kind of a reaction with other types of stimulation, it's actually pretty uncomfortable.
Oh, really? Okay.
Yeah.
Okay.
But this one, the way the waveforms are and how they've designed it, we get that massive contraction without any really discomfort.
Good to know, as always. Just cutting-edge treatment with Dr. Ackerman. Thank you, Whitney. Thank you, Dwayne.
Yeah.
We'll be back with more Lifestyles. Merritt's here next.